So last class, we talked about the formation of red blood cells, right? Erythropoiesis, that's the process of erythropoiesis. And we finished up with erythropoietin mechanism, which is the mechanism that is used, or your body uses, to stimulate more red blood cells as needed. So whenever you're in stress, right? Whenever you have low amount of hematocrits or low amount of red blood cells overall, or less oxygen imparted into your tissue, right? Or high amount of CO2 buildup, then that stresses the tissue and it tells your body that it needs to get more oxygen to that area, correct? So there are two fates of that, and you can write it down. The first fate is that first thing, stress. Now, by causing stress, your body does the following. One, stimulates the production of new red blood cells by stimulating EPO, that's what we see here, right? So whenever you have an imbalance, okay, there's a reduction of oxygen levels in the bloodstream, or the tissue becomes hypoxic. So if the tissue becomes hypoxic, then your kidneys will measure this thing up and it will stimulate the release of erythropoietin, EPO. And then EPO is going to go into your bloodstream again, and that's going to go all the way to your blood vessels, right, into the capillaries that reach your bone marrow. And that will be, of course, the red bone marrow, not the green one. So the red bone marrow. Now, that red bone marrow receives this EPO, erythropoietin, and that will stimulate the red bone marrow to produce more what? Red blood cells. Okay? Now, since your bone marrow is producing new red blood cells, it takes about what? 5 days, we said more or less, right? To create reticulocytes after the 3 day, or to make a mature red blood cells. Everybody got that? All right. Now, once you have that, of course, now you're gonna have more carrying capacity or more oxygen taken to the tissue that was hypoxic. Okay? So that's the first event after stress, right? Which is making EPO and getting more oxygen to the tissue. So far, so good? If you constantly stress the body and that specific tissue, what else does your body do? And that is create new pathways or collaterals of capillaries. That means that if you go to the gym, you have to, when you stress, you see that all your veins are popping up, right? So not only the veins, but during a chronic amount of time, means after a 6 months period, that tissue is going to start to create or stimulate new collateral circulation, means new blood vessel connection between areas that were no longer there. And that example is typical seen in adults versus newborns or toddlers. If a toddler or newborn suffers a myocardial infarction, most likely they will die right away because there's not a lot of collateral circulation around the heart. If an adult suffers from an MI, ischemic attack, they most likely tend to go and surpass it because through life, as a newborn toddler, right, and early adulthood, they're being stressed little by little as you play, right, as you feel tired, that's stress. And that creates more collateral around the coronary arteries of your heart. So that's the reason, well, this is one of the explanations that I'm trying to get. Okay, we're going to see that later on in the heart. So blood types, we have different type of bloods. The main thing that you need to know about the blood types is the ABO, right? Is either blood type A, B, or O. So for the blood types, you have something known as antigens and antibody. That is what I want you guys to master. That is, antigen is a substance that triggers an immune response. Again, most antigens are foreign. They're not part of your cells. But on the actual red blood cell, the antigen is part of the red blood cell. And if you think about this, the antigen is not more than a receptor found on the outer surface of each individual cell that you possess. Does that make sense? So how does your body recognize what blood cells or what tissues do you have? By looking at the receptors on the surface of the tissue or the blood. We call that antigen. But when we go to the immune system, which is later on, right, lymphatic immune, you're going to see that they define antigen as something that is foreign. Why? Because that tissue that you have in your body, you're not supposed to share or give it to anybody else, correct? So as now that red blood cell or that tissue is put or enters other people's body, then that is considered to be what? Something foreign, right? Something that does not belong there. So please keep that in mind. So if you have antigen group A for the red blood cells, that means that your red blood cell will be what? Your red blood cell will be what? A. So whatever you have on the surface, it tells you what type of cell it is. If you have antigen B, O, that's what you're going to be as a red blood cell. Now, what is an antibody? An antibody is what defends your body, right? So the antibody is part of your immune system. An antibody corresponds to recognition, right? So it's going to be recognizing the antigens. Your antigens? No. Foreign antigens. Does that make sense? And these antibodies, later on, we're going to talk about them, and they're going to be your white blood cells. They're going to be part of your white blood cells. Okay? That means whenever you have an antigen-antibody reaction, you're going to get something like this. So antigen recognized by plasma cells. Again, plasma cells equals antibodies equals white blood cells. That's how you should put it in your notes. They're synonyms of each other, more or less. So if you see something about plasma cells, these are your B cells. I'm not going to go in detail. But plasma cells are the same thing for now as antibodies, which are part of your overall white blood cells. So white blood cells are antibodies and plasma cells. Everybody got that? So if any of the white blood cells, right, on our plasma cells recognize an antigen, then you're going to create something known as a what? Agglutination, which you can see that each one binds to the corresponding antigen, and you create an agglutination process. Now, agglutination is an antigen-antibody. Rx means reaction. Everybody got that? All right. So antibody B is going to bind to antigen B. Antibody A is going to bind to antigen A. Everybody got that? As you can see here, right? Different shapes, different antibodies. So that means that antibodies needs to be specific for the antigen. Does that make sense? Now, this happens not only on the red blood cells, but it also happens for everybody that does transfusion, blood transfusion. So we're going to take that a little further on. That's the application of it. And we're also going to talk about the transplant. So a transplant, if you think about it, is you're transplanting a tissue or cell from one person to the next person, correct? So we have blood transplant. Blood transplant. What does that mean? Nobody calls it that. People call it what? A blood transfusion. But it's actually a transplant because you're transplanting tissue from one person to the next. In this case, it will be the cells, right? So if you are blood type A, what type of blood type would you like to get? A. If you're blood type group A negative, then you're get A negative, right? For a transplant, it's pretty much the same thing. It needs to be corresponding to the individual you're going to be transplanted. Let's say, for example, you need a liver, you need a kidney, or you need a pair of lungs, right? You want the same blood group type. So if you're A positive, the tissue that you're getting from somebody, it needs to be what? A positive. Or it can be a universal donor, right? And the universal donor is known as O. So it means O can give blood to almost anyone. Okay? Same thing for transplant. So here are your blood group types. So type A has what type of antigen? A. Type B has what type of antigen? B. Type AB has what type of antigen? And O has how many type of antigens? None. Look, it says no surface protein. O, think about it as like, oh my God, I'm naked. Means you have nothing on your surface. Okay? Now, when we talked about antibodies, if you're type group A, what are your antibodies? That means that your antibodies will be something that you're not, right? So that'll be antibody B. If you're blood to a B, what is your antibody? Something that you're not. And if you're type AB, what is your antibody? If you're A and B, what are you going to do? You're going to kill A and you're going to kill B. Would you like that? No, it's not worth it, guys. Okay? Don't kill yourself. So that means that if you're half A or half B, you cannot have neither antibody A nor B. So AB is no antibodies. Everybody got that? Now, this AB is known as universal recipient. That's a universal recipient. Means that you can get blood from where? From people who have A or B or O. Woo! You can get everything. That's good, right? What do you want? I get everything. So, in other words, you're not picky. Type O. Type O is universal donor. And the reason why it's universal donor is because it has no antigens. What is reacting? And think about this. You are blood group O, type O, right? You're donating blood O into somebody who's B, right? What is reacting? Your antigen, let's say you're the donor, you're O, and you're the recipient, you're B. If she gives her blood to her, that means that what is her body, right? The recipient is going to recognize out of the donor. Just the antigen. Does that make sense? Because what are we giving? Nowadays, we can give what? A blood pack. What is a blood pack? A blood pack is that they take the whole blood, which is, again, plasma and form elements, and out of the form elements, they just take what? Red blood cells. And they exclude all the whites. You get it? So if from O, the only thing you're getting is the red blood cells, which is called a blood pack, right? All you're receiving is your antigens. Since it has no antigens, when her antibodies A look for an antigen, they're not going to find anything. Does that make sense? That's why O is universal donor. On the opposite side, when we have type AB, you are going to have pretty much no antibodies. So you can donate into a type AB whatever antigen you want, because at the end it has no antibodies. So there's no antibody antigen reaction. There should not be any agglutination. Does that make sense? No. And you can see that here. Now, what is the whole importance of this? Well, think about this. If you have an antigen-antibody, agglutination means that your cells are going to kill. The red blood cell is going to kill the tissue. If this happens, you stimulate or you elicit a disseminated intravascular coagulation. It means what? Disseminated means around the body, whatever the blood is reaching. I guess if you donate blood, it's going to go into your bloodstream, right? And that's on the whole body. And you're going to start to increase the amount of what? Blood clotting. Because as you break the blood, you increase the clotting mechanism, right? And that is a massive agglutination through the whole body. It's going to lead to a massive systemic shutdown, right? If you transfuse the wrong things, or at least to the tissue on an organ at the beginning, and then it continues from there. And here you can see the agglutination process, right? The antigen-antibody, right? And that's, of course, the agglutination, what it leads to. Again, agglutination, what's the other word for agglutination? Rupture of the red blood cell, right? And this agglutination is causing what? An increase in blood clotting. Let's put it that way. Blood clots, all right? Through the whole body. You know, it goes know when you have a blood clot, if it tampons the whole vessel, then the next blood cannot go through, so you have ischemia, right, to the tissue. Okay? And then that's what we did in the lab, right? The typification of it. Now, there is a subgroup of the Rh, which is a rhesus subgroup, and that is either positive or negative. If you're positive, this is just talking about another receptor. Let's say you're A. And then if you have the next receptor, then it means you're what? Positive for it, right? So you have no antibody against the receptor. If you're negative, it means that you have no receptor there. That means you will have a antibody. Does that make sense? Now, the whole point of this is to bring about this IgD. Okay? So no anti-D, antibodies. For what? For the Rh positive. Why? Because you have it. What is IgD specifically for? IgD is known as an immunoglobulin. I is for immunoglobulin, and the letter is D. So in other words, it's a protein, globulin is a protein, right? That is going to be part of your white blood cells later on, your immune system. Okay? We talked about the blood transfusion already. So here is the application for IgD, and that is known as hemolytic disease of the newborn. If you are a female, right, or an male, this will affect both sexes. If you are a female and you are blood group negative, how many of you are AVO negative? Like A negative, B negative, AB negative, O negative, anybody? Nobody knows. So this is something that you really would like to know. Next time you go to a doctor, right, tell them that you need to find out what blood type you are. You need to know that. That is part of, like, you need to know how to turn on a cell phone and how to charge it. It's as simple as that. You need to know that. So if you're a blood group negative and you have a child inside of you that is positive, that means if you're negative, you're going to have the antibodies, correct? But if your child is positive, then your child means is going to have the antigen, correct? When mama antibodies sees the child antigen, let's put fetal antigen, and this is mother, what's going to happen? It's going to get agglutination, correct? And then clotting, and then what? Hemolysis, the baby is going to get killed. In other words, you as a mom would and will kill your own baby. Is that important? Yes. Now, does that affect the male? Of course. If you are a mom and you're negative and you marry a guy who is negative, so you need to worry about it. No, they're all the same. They're all negative. So let's say you find the man of your life, right? And you decide to marry that person, right? Or you get artificial inseminated, make sure you know the blood type. I mean, nowadays that's really common. A lot of people are doing artificial insemination. Make sure you know the blood type. But if they're both are negative, you have nothing to worry about. Negative mom, negative baby, everybody's negative. Right? We're good. Now, but if you marry or you get from a positive guy, that means that you have a chance, at least a 50 chance, that your child will become what? Positive. Does that make sense?
But the mom
That means
is positive?
no, the mom is still negative.
Oh, okay.
So if you marry somebody or whatever, if you had a baby, not marriage,
Right, so it can
marriage is out of the door. So if you're with somebody and you decide to have a baby, right, the baby can have 50% chances more or less, right, that the baby can be positive.
But there's treatments, like they give you
Hold
shots.
on, let me stress
Yeah,
it.
I got it.
Can you stress it? Let me stress it. That means that you're going to kill your kid, right?
That is terrible.
That's stress. Now, thanks to technology, nowadays, we're able to solve the problem. And that is what? You get something known as an injection. That's what they said. So when you go to your OBGYN, right, they check for the blood group type of you and your baby through blood, and then they tell you to get Rogaine. Not Rogaine, not the Rogaine for the hair, Rogaine. And Rogaine is a IgG. What is IgG? Right, the immunoglobulin T. And that is going to decrease highly the percentage and the chances of you killing the positive baby. Does that make sense? Everybody got that? Now, you usually get them when you're pregnant, around, the first 2 weeks of pregnancy, okay, more or less. And then if you need a shot or a boost, is 24 hours or before 24 hours. Now, think about this. If you go through it once, that means you can have as many positive babies as you want to? No. Every time you go, they check for it. They check the levels of IgD that you have. If they're low, they still got to give you another boost. So that way you don't stimulate this reaction. If you don't know about this and you go through life, or if you go to a doctor and he fails or she fails to do this exam, what's going to happen? It only takes once, okay? You go through, nobody tells you about it, you already create the antibody. Once you created the antibody, there's no way back. It doesn't matter how many boosts of IgD you get, the chances are really slim to none, right? As far as I know, okay? Really slim to none, not to get another child, all right? So that means you have to find another partner, all right? So what are some of these erythrocyte disorders? So I'm going to talk about a little bit disorders. So the first thing we're going to talk about is anemia. Means anemia is when you have a low amount of red blood cells. And of course, iron is in the red blood cells, right? So iron deficiency will lead to anemic person, right? So that overall causes a what? A decrease in oxygen carrying capacity. Anemia is actually what? A symptom. What is a symptom? Something that you feel. A sign is something that you can see. You can tell me that you feel tired. I have no way of finding that out because you only can feel it. Okay? So a sign is something that you can see on the person. A symptom is something that they feel. So you have to go with what they say. So normally in females, you have somewhere around 14 hematocrit. It has to be greater than 14 hematocrits, right? If it's anything below 12 by United States standards, right, you will be known as red line or tell you that you are anemic, right, on the hematocrit side. That means that they're going to tell you to take what? Iron supplements, right? Normally in the prenatals, you have plenty of iron supplement as well. Okay? Just to prevent this from happening. So what are the signs and symptoms? You're going to have fatigue, paleness, shortness of breath, and you can actually all have chills. Okay? Now, anemia is due to a low amount of erythrocytes, but these are the main causes. Hemorrhagic, which means what? Hemorrhage means bleeding, right? Profusely bleeding. And that can be either an acute bleeding or chronic bleeding. When females go through their cycle, what type of bleeding would this be? So when you menstruate, is that chronic? Through the cycle, that's an acute bleeding. It will be chronic through your lifespan, but does not happen every single day, right?
Right.
So that's an acute event that you experience every single month, and you get sufficient time to recuperate from it, right? Hopefully. All right. So a chronic blood loss is something that is constant for over a period of time, like almost every single day. Now, hemolytic anemia, what is it? Hemo means blood, lytic means lysis or breaking down the red blood cell. So it's a premature rupture of your erythrocytes. Normally your erythrocytes last for how long, guys? About 120 days. So if they last about 120 days, what does that mean? Well, that they are killed or dead or something happened before the 120 days, correct? That is known as premature rupture. That falls within the hemolytic anemia. And then we have aplastic anemia, which is the destruction or inhibition of red bone marrow. What is the red bone marrow? Well, in the red bone marrow, we had creation of 3 cell lines, red, white, and platelets. So aplastic anemia not only affects the red blood cells, but it may also affect what? Whites and platelets. Which are the individuals that tend to suffer from this the most? The most common ones nowadays? Chemo patients, right? Whoever is going to chemotherapy. Radiotherapy as well. And if you're taking a lot of drugs, some drugs actually are known as a side effect to cause aplastic anemia. And I think one of the easiest sites that you can actually look for this, like rxlist.com. I'm not promoting this thing, I don't get paid for this, but anyway. But I think it's really good, rxlist.com. And whatever medication you take, you can check there, and it even give you samples of population size and how many, what are the side effects? rxlist.com. So you can check all the side effects of any medication that you want. Is there, as long as you know what you're looking for, should at least give you a nice idea. So if you have aplastic anemia, and the most common types are kids, right? Newborns, toddlers, which are suffer from acute lymphocytic leukemia, or something known as myeloid leukemia, leukemias, right? In Spanish, leukemias. In English, leukemia, okay? So those are the most common ones. So any individual who tends to have a leukemia is affecting, right? Is actually going to be affected on the aplastic size of the bone marrow. So anemia, hemoglobin less than 12. That's how you count your hematocrit, which is the hemoglobin times 3. And of course, that's about 37 to 41, right? I'm not gonna ask you any details, but at least know, guys, what a hemoglobin is. If you know, like, your hemoglobin is less than 12, right, you are going to be tagged as what? Anemic, right? When do you need transfusion? And that's only when your hemoglobin levels reach 8 or below 8, right? You automatically are put on the transfusion. You have to get a transfusion, okay? Now, if you have a hemoglobin less than 8, they say your system is suffering and you most likely will not survive. That's why you get a transfusion. Does that make sense? Now, there are things that comes into play, and later on we're gonna discuss it, and that is individuals that do not like to be transfused. Like, there's individuals that they cannot, by religion, they do not allow you to get blood into their bodies, right? Jehovah's Witness is one of them. Now, there's some events that you can override that, as long as you know that somebody's really needed, okay? But those are the intricate things later on that you're gonna learn. Now, the next thing is the anemia. So you have a hypochromic. When they say hypochromic, means what? Chromic makes the actual amount of iron. So hypochromic means is an iron deficiency. And microscopic means the less amount of iron you have, and vitamin B12 and B6, right? This can actually lead to a microcytic, means small red blood cell with low amount of iron. So a tiny red blood cell with low amount of iron. And what gives you that microcytic? Well, probably on labs, you're gonna see something known as MCV, which is middle corpuscular volume. I don't know if you've ever seen that before. But if it's if it's less than 60, more or less, that will give something like that. Now, the megaloblastic anemia, that's the one that I want to focus more on. And that megaloblastic anemia is caused by a deficiency of vitamin B12. That means if you're a strict vegetarian, you're going to have B12 deficiency, right? Because that's only found in meat products. And then if you have an MCV greater than 110, you're tagged, right? Or you're diagnosed with a megaloblastic anemia, okay? Or macrocytic anemia. That is because you have either a folic acid deficiency or a pernicious, which means a vitamin B12. So what are the causes of megaloblastic anemia or macrocytic anemia? Folic acid and pernicious anemia, which is your vitamin B12. Any questions? No. Now, the one of hypochromic and microcytic, you can look. Alcohol, chronic alcoholism can lead to that. Lead used to be in a lot of paints, old buildings, right? Nowadays, pretty much every building is being repaired, at least in part of Florida, right? But like historical buildings or something like that, there's a lot of lead in the walls. You're not eating the lead, right? But your kid might, because they don't know better, right? And of course, any other toxins can lead to that. But again, focus on megaloblastic anemia. That's what I want you guys to know. Now, if you have pernicious anemia, it means that you have a low vitamin B12. Two things: either you don't eat sufficient amount of meat products, right? Lack your proteins, or you lack intrinsic factor. What is intrinsic factor? Intrinsic factor is what allows the vitamin B12 to be absorbed into your body. So you can take as many vitamin B12 as you want to. If there's not a proper amount of intrinsic factor in your body created, all the B12 that you get, you're gonna either pee or poop. So where do you actually make intrinsic factor? Later on the digestive system, we're gonna talk about it, but intrinsic factor is made in most of the time in the stomach, fundus of the stomach, okay? So that is required for your body to make. So people who go from resections like bypasses, gastric bypasses, or the resection of the stomach, they don't do that anymore, they use the sleeve now. But this type of individuals tend to suffer a lot from megaloblastic anemia because they just remove a part of the stomach. If stomach is half functional. So the treatment for vitamin B12 is what? If you don't have B12, what do you do? If you don't have a car, what do you do? You buy one, right? So you get intramuscular injection of vitamin B12. Intramuscular. We don't do it IV. We don't do it orally. It's inside the muscle. We don't do it subcutaneously. We do it in the muscle. Okay? Now, in anemias, you have hypochromic, microcytic, right? We said hypochromic is low iron content. Microcytic are tiny, small red blood cells, right? So of those, we have something known as thalassemias. What are thalassemias? That's a faulty globin chain of hemoglobin. Remember, it's half hemoglobin, right? So that hemoglobin is not working correctly. That means your erythrocyte tends to be really thin, right? And of course, deficient in hemoglobin. If your hemoglobin is deficient, can you carry oxygen? No. We talked about different types of hemoglobins, right? Hemoglobin A, 1, A2, and adult hemoglobin, hemoglobin F for fetal, right? The 2,3-DPG. So that's what we're referring to. Now, normocytic, microcytic, right? Normal means normal, chromic, which means what? Normal levels of iron. You're not iron deficient. Should you give supplement to these individuals of iron? No, it's normochromic. They don't need iron. The only problem that they have is that they are small red blood cells. Microcytic. Just think about it. Chromium or chrome means iron in this case. So, which are the individuals who suffer from normochromic, right, microcytic? And that is sickle cell anemia. Did we talk about sickle cell anemia? You said sickle cell anemia is high frequently in African American descent, right, close by. And then we had, that is actually a mutation between valine and glutamic acid. So it's a single base pair mutation, okay, that damaged the whole red blood cell, and in the presence of low amount of oxygen or high CO2, that cell that is a normal red blood cell will just become what? Sickle. Means half a moon, right? That's only during stress environments. So that is the formation of your hemoglobin S, which we talked about, right? I would say it's a single amino acid substitution. The other ones, I'm not going to go in detail, but these are all the ones. So as you go further in your studies, what they're going to teach you based on the pillars that we're creating right now is these things. The diseases, the most common diseases that you're able to find by each one of the systems. So in blood, these are the common diseases. That's what you're going to see the patient's going to come in with. And you should be able to treat it and find out how to solve the problem. At least have an idea on it. That's how later on the classes, higher upper level classes, will be set up for you. Right now, I'm just trying to give you the basis of understanding behind these things. Okay? This is just a small peek. The next one is polycythemia. Poly means many. Cyto means what? Cell. Emia means blood. You want me to do that again? Poly means what?
Many.
Many. Cyto means what? And? Yeah. And emia means what? Blood. So you have many cells in the bloodstream, right? Again, blood is what? Plasma and foreign elements, right? Okay, so polycythemia is an excess of what specifically? And that is an excess of red blood cells, right? RBCs. The more content that you have, any foreign elements, the more you have more foreign elements in the blood, that's going to cause for what? A traffic jam. When you get out of school around 3 or 2 p.m. and you want to go home and the streets are closed, or in the morning trying to come here and there's one car after the next because there are too many cars and there's only 1 or 2 lanes, what we call that? Traffic jam, right? The same thing happens. You have a single blood vessels or a few blood vessels and you have a lot of red blood cells, so a lot of cars in there. The more foreign elements you have, the higher the chances of getting viscosity. Viscosity means what? The traffic jam that I said. You can see it in another way. I like to call Aunt Jemima to the rescue. So, I like pancakes. So anyway, if you got water, how do you make Aunt Jemima? Syrup. I mean, more or less. I don't know either, but more or less.
Flour?
The syrup? The syrup. The syrup is supposed to be mostly what? Water and sugar, right? Now if you put maple syrup or whatever it is that they put in there. But water versus water with sugar, right? The more solutes you put in the water, the more Aunt Jemima-like looks like, right? And to a point that as you put more sugar, that is not water anymore, it becomes so viscous, correct? So viscosity has 2 downsides to it. One is that it takes longer for the bloodstream to reach point A from point B. Does that make sense? If you were to drop water versus Aunt Jemima, which will touch the floor faster? Water. Imagine passing through a small tiny tube. Water for sure, right? So the higher the viscosity, right, means you're going to have a higher chance of developing what? Clotting, right? It's going to increase the time that you're going to deliver oxygen to your tissues, right? Does that make sense? So that oxygen that is carrying in the blood, right, that perfusion of oxygen will take longer. So there are 3 main types of polycythemias. Let's talk about those. So there is polycythemia vera, and there's a secondary polycythemia mainly. So a secondary polycythemia is caused by what? Secondary to what? That's why it says secondary, right? To low oxygen content. Every time you're under stress, we said that the side effect of it is what? Stimulating EPO and making more red blood cells, right? The more red blood cells you have, well, the more viscosity you put in the blood, right? So that might lead to a secondary polycythemia, which is a overactive E-poietin, right? Erythropoietin. Does that make sense? EPO stimulates your red bone marrow to produce more red blood cells in the case that you have no oxygen in your tissues. If you overstimulate EPO, because you may have an endocrine problem, right? Or a positive feedback event, which is not supposed to happen.
That's a hormone.
Right? That means that you can cause a secondary polycythemia. Okay? And of course, that causes increased blood clotting, and time the oxygen will be delivered to the tissue. Now, what is the other cause of polycythemia, which a lot of competitive athletes use?
I was just gonna say, when you train, can that happen?
Blood doping. Yes, we said that if we are competitive trainer, we said you go high altitudes and you fly the same day or the day before, right? And then you have a lot of blood in you, a lot of red blood cells. Yeah, that is increasing the viscosity of the blood. Hopefully it's not that much that you're gonna get a clot and you die, right? But it's gonna help you overachieve whatever limits you already had before, right? Normal conditions. So yeah, blood doping means it's not training at high altitude. That's naturally. Blood doping is taking blood out, right? Giving your body about 5 to 7 days to create new blood. And then the day of the competition, right, or the day before, what do? You put the blood back, the red blood cell pack, back into your body. So now you have more oxygenation to your tissues. Okay? Who was accused of doing something like this? The guy with the testicle? I don't remember. Cyclist?
Yeah.
Armstrong. Right. So they were actually injecting themselves with growth hormone, EPO, and then at the same time they were doing the blood doping. So the day of the competition, in the morning, they used to put blood back. So they took blood and they put it back. So remember, your body takes about 5 to 7 days, right, to have a fully developed red blood cell, right? So the more red blood cells you have, well, the better you're gonna perform. So you're gonna outperform anybody else.
It's like a cheat to not use steroids.
Correct. Right? So form elements, right? Platelets and white blood cells is the next thing that we're gonna talk about. We spend a lot of time on red blood cells, which is 45%, right? Oh. So the form elements, what do we have here in this table? So everything comes out for one thing, and that is what? What is the mother cell of everybody? Hemocytoblast. I'm confused. I don't know what you're talking about. Really simple. Let's break this down. Hemocytoblasts are capable of giving what? Platelets, white blood cells, and your red blood cells. Do you see that? So the hemocytoblast is a pluripotent cell. Okay? It's capable of creating reds, whites, and platelets. Everybody got it? Now, from there on, we already did the red blood cells, right? So I'm going to delete this one, and let me delete this one. We're going to focus now on platelets. So platelets, they arise from one cell, and that cell is known as the mother cell of all platelets. That is known as megakaryocyte. Platelets do not have a nucleus. Platelets are pieces of this humongous cell. Like imagine as you shed the skin, platelets are outer compartments of this megakaryocyte. They do not possess a nucleus. So there are two cells in your body that have no nucleus. Write that down. One is going to be what? An adult red blood cell. Does it have a nucleus? Adult red blood cell? A mature red blood cell? No nucleus. A mature one? No. Immature? Yes. Remember, after the 3 days, 3 days was the reticulocytes. They're the only one that are immature red blood cells, right? And they have tiny nucleus. From there on, every single mature red blood cell has no nucleus. What is the next cell that have no nucleus in your body? Platelets. So only 2 cells in your body that have no nucleus. Platelets and mature red blood cells. Now we're done with platelets. The next thing we're going to talk about is what? White blood cells. So white blood cells are divided into 2 parts. One is granulocytes, and the other is what? Agranulocytes. So granulocytes is B, E, N. I like to give it the name of Ben. Ben has granules. Just remember that. So basophils, eosinophils, and neutrophils means these 3 have granules, hence the name of granulocytes. So white blood cells are divided into 2 groups. Those were granules and no granules, right? The granules, granulocytes, and no granules are A means without, right? Granulocytes. So what are the other ones? ML. Monocytes and lymphocytes. Of these lymphocytes, what do you need to know? There are 2 types of lymphocytes. Do you have, what is that you like to watch every single day? TV? Well, this is not V, it's actually B. Alright, so TB.
Oh, T cells and B cells.
Right, so lymphocytes type T and lymphocytes type B, means T and B cells. Huh? NK cells, yes, they are lymphocytes as well. So the mnemonic to learn all the white blood cells is the following. That's the one that I use. Mom never let me eat beans because I get gassy and bloated. So M is for what? N is for what? L is for what? E is for what? And B is for what? You got it? So lymphocytes, just know there's T, B, and now we're adding the new one, which is your NKs, natural killer cells. All right? That's where I said wait. And then in these tables, you can read it. It's actually a summary of each one of them and what they actually do. Alright. So you can see here that the main function for neutrophils is to neutralize, right? And basically neutralize anything that is affecting the body. So anything higher with neutrophils, we're going to call it what? Neutrophilia. Anything that has high amount of eosinophils, we're going to call it what? Eosinophilias. They are the fight against parasite and flukes. And basophils, right? They enhance inflammation, so they are the mediators for inflammatory process. These granules are going to contain two things: histamine and heparin. Histamine is a vasodilator effect. How's the vasodilator effect? And heparin is an anticoagulant. Have you ever had like rosacea, which is reddish of your face? So that reddish of your face means that there is a high amount of blood capillaries, right, that are dilated. So more blood goes into your skin or near your skin, hence you get that reddish color. That is a vasodilatory effect. If you have allergies, that's one of the things that causes it. Right? And heparin, you want blood to be anticoagulated, because if you coagulate the blood, you're just gonna blood clots, right? And the last thing is M and L, right, which is the monocytes and lymphocytes. Monocytes, the other name for it is macrophages, and they help you engulf bacteria or any cellular debris. So engulf bacteria debris. And finally, your lymphocytes, right, which we talk about, your T's, B cells, right, and your NK cells.